You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Glutathione. Tonight we're talking about this very, very powerful, what many refer to as the master antioxidant. Now, what does an antioxidant do? An antioxidant helps you age gracefully. Well, let's talk about glutathione. What actually is it? So a lot of you take it supplementally. Maybe you've heard of it in relationship to detox, or maybe you've heard of it in relationship to inflammation. But what glutathione is it is a combination, it's called a tripeptide, a combination of 3 amino acids. So we got amino acids, which are derived from proteins. But in particular, this is composed of cysteine. Sometimes we see the term L-cysteine, and sometimes there's actually a supplement called NAC, if you've heard of NAC, N-acetylcysteine, right? So cysteine being one of the building blocks, the amino acid glycine, as well as the amino acid glutamine, and technically it's actually glutamic acid, but glutamic acid converts into glutamine to help build glutathione itself. So it's composed of these 3 amino acids. So think about that in terms of your diet. If your diet is low protein, if you're not getting enough of these essential nutrients or enough of these key amino acids, then it could put a dampering effect on your body's ability to generate glutathione. Now, what is glutathione? It is the most abundant free radical scavenger. It's in all your cells. Every one of your cells has glutathione. And so why do we need it? What is a free radical scavenger? Heard that term, kind of imagine a teeter-totter here, and on one end you have free radicals, on the other end you have antioxidants, and there should be a decent balance between these two things. Free radicals are a normal part of body function. We generate free radicals during normal biochemical processes. We can also generate more free radicals if we have certain behaviors. For example, aggressive exercise generates free radicals, smoking, excessive alcohol consumption, excessive stress, right? So general life and life experiences generates damage. Our antioxidant system is designed to help to offset or repair that damage. So think of this as like a nice balance between the two. If our free radicals outweigh our antioxidants, we end up aging at an accelerated pace. Our DNA becomes damaged more readily. It increases the risk for certain types of diseases. But if these two are relatively balanced, again, we're going to age gracefully. And that's why glutathione is so important. It's the most abundant antioxidant, free radical scavenger that we make, and it's most powerful. So very, very important that we have it. If we look at some of the functions of glutathione, again, being a little bit redundant here, but it protects the body from oxidative stress as a master antioxidant. It also helps to recycle vitamins. It helps recycle vitamin C and vitamin E. These are also antioxidants as well. It aids the liver in its ability or capacity to detoxify. It also supports the kidney and the GI tract's ability to eliminate toxins. So again, coming back to toxin removal being a very important job here. But it also aids the immune system. Research has shown that glutathione actually helps in the production of a type of immune cell called a T cell. It helps them work more effectively and more efficiently. It also helps to increase the level of something called natural killer cells, NK, that's natural killer. These are the types of cells that help us fight cancer, right? So glutathione, very important in that regard. It also supports sports performance by supporting the ability for us to make nitric oxide. Remember this substance, nitric oxide, is a very powerful vasodilator. It dilates blood vessels, thus increasing oxygen and nutrients to our tissues, in this case with exercise It's very important for the muscle. If the muscle doesn't get enough oxygen or nutrients, it's going to wear out quicker, and our sports performance is going to be reduced. So again, these are some of the major functions of glutathione. Now, let's bring up a nice image for you. And those of you who are looking to look at these images in a more high-resolution fashion, if you'd like to do that, in our comments below, we'll put a link to all of these images so that you can download them and go through them at your leisure. So know that those are there in the comment section. But if you look here, glutathione, okay, at the central core here, you can see glutamine, cysteine, and glycine. Okay, glutamine turns into glutamate, cysteine turns into L-cysteine, glycine comes in, so all three together combine to form GSH. GSH is glutathione in a nutshell. It's glutathione that is what we would call reduced. Reduced not as in small amounts, but reduced as in it's reduced, it's ready to be a free radical scavenger. So this is its active form. So think of the term reduced as the active form of glutathione. When glutathione is used up, it turns into oxidized glutathione, or GSSG. So this is oxidized. And we have to recharge its battery, so to speak. It's recyclable, so we can take glutathione and we can use it up and then we can recharge it. And this recharge, you can see this term here, NADPH. This is actually a form of vitamin B3. So vitamin B3, niacin, plays a very important role in the regeneration of glutathione. As we'll talk about here in a moment, selenium also plays a role in recharging glutathione as well. But look at some of the functions here. If you look at the different functions, one is in right here in this red column. It says ROS neutralization. What is ROS? ROS stands for reactive oxygen species. This is basically, these are free radicals. What I was talking about earlier is glutathione helps to neutralize or offset the damage from free radical production in our body. Number two, over here, you can see AOX recycling. That stands for antioxidant recycling. In the case of glutathione, it very much helps to recycle vitamin C and helps to recycle vitamin E, both very powerful antioxidants. Then we have detoxification, and this detoxification predominantly is the liver, right? So the different enzymes in the liver that help you break down toxins that you're exposed to, pollutants that you're exposed to. If you're on a lot of different kinds of medications, you use glutathione to help slowly break those medications and excrete them out of your body. And so then we have number 4 over here. It also aids in our body's ability to repair proteins. Damaged protein is something that happens on a regular basis in our bodies, and so we need ability or a way to help that repair. So if you look at glutathione as a whole, these are its big 4 major functions that you want to understand and why it's so important. Okay, let's talk about diseases that are associated with low levels or reduced levels of glutathione. And this is not at all intended to be a list that is the master list, because theoretically glutathione, because of its role centrally as an antioxidant, understand that every disease, every chronic degenerative disease that is inflammatory in nature, glutathione helps the body with that inflammation. So we could really draw inference that any inflammatory disease could be contributed to, in a sense, by lower levels of glutathione, because glutathione is what our body uses to protect us from inflammation. However, that being said, there are specific diseases that have been studied and researched and linked to low glutathione. One of those is neurodegenerative disease, and specifically in neurodegenerative disease, multiple sclerosis is a type of immune, but also a type of neurodegenerative disease, dementia, as well as Parkinson's. So these have all been linked to glutathione being low. Heart disease, this includes hypertension and increased risk for heart attacks or myocardial infarction. We also know that chronic liver disease is associated with loss or lack of glutathione. We know that autoimmune diseases like lupus and rheumatoid arthritis are linked to glutathione deficits. We know that people that have uncontrolled diabetes, that not only can that cause or contribute to low glutathione, but low glutathione can make it harder to control diabetes. We know about infertility, as it's especially true for both men and women. So it's not just ladies, because a lot of times women are blamed on infertility, but this is also for fellas, for men. And one of the reasons why is that the sperm cells themselves, this little tail on the back of the sperm, its ability to move or generate energy, it impacts the sperm's survivability. It impacts the speed at which the sperm can swim upstream and fertilize an egg. The sperm also requires tremendous antioxidant to protect it while it's on its journey. And the main antioxidant that's helping to do this is glutathione. So a lot of times we'll see men with low glutathione will have low sperm quality, or sometimes what's called viability. Your sperm will die too quickly and can't make the journey. So remember, glutathione also protects the female's eggs, so it works in both men and women. And then we have a number of different mental health disorders. We know that many of these disorders, like bipolar and depression, are actually inflammation manifesting neurologically in the brain, and glutathione certainly can help with that. Now let's look at some of the research studies specifically. Again, this is not intended to be an ultimate comprehensive review on all the research around the diseases linked to glutathione, but let's just look at a few of these studies. So you see here, glutathione is generally a safe ingredient for use and is regarded as food or health supplements in most countries. While it is considered a pharmaceutical agent, I think it's important to point that out. Glutathione is so powerful that many countries consider it to be a drug for the treatment of illness and disease. So in some countries, it's considered to be a pharmaceutical agent. It could be used as both as a protective and a therapeutic agent against several diseases. Important to understand that kind of synopsis of glutathione. Now, also have some studies here specifically. We'll check these out. So you can see this was published in Frontiers of Neurology. Glutathione, a Samsonian life-sustaining small molecule that protects against oxidative stress, aging, and damaging inflammation. Again, an anti-inflammatory. So let's just paraphrase here. Many local and systemic diseases, especially diseases that are leading causes of death globally, like chronic obstructive pulmonary disease, like asthma, atherosclerosis, with ischemic heart disease and stroke, cancer, and severe acute respiratory syndrome, like COVID, causing coronavirus, involve both oxidative stress with excessive production of reactive oxygen species. Remember, that's the function of glutathione. It's to neutralize those that lower glutathione levels. Therapies enhancing glutathione could become a cornerstone to reduce the severity and fatal outcomes of inflammatory disease, as well as COVID-19, and increasing GSH levels may prevent and subdue these diseases. GSH depletion as a fundamental risk factor for diseases like chronic obstructive pulmonary disease and atherosclerosis. Importance of oxidative stress and antioxidants in SARS-CoV-2 infection and COVID-19. 3, significance of GSH, that's glutathione, to counteract persistent damaging inflammation, what they're calling inflammaging. Again, excessive inflammation accelerates aging, and early premature inflammaging associated with cell and tissue damage caused by excessive oxidative stress and lack of adequate antioxidant defenses in younger individuals, and new therapies that include antioxidant defenses and restoration. So again, a lot of that, if we paraphrase a lot of that, it's that a lack of glutathione can accelerate inflammation. Many diseases that are inflammatory in nature will burn through your glutathione levels, making glutathione a suspected therapeutic agent that could be used in the potential for treating a lot of these different types of problems. Again, that author's opinion. Let's look at some of the research here. You can see here research in atherosclerosis. So They did a study, and this is a human study, on 114 healthy non-smokers without known clinical atherosclerosis who had carotid intima-media thickness measured. In other words, this is a test that measures the carotid artery and whether or not there's any type of atherosclerotic plaquing in that artery. As well, oxidative stress was estimated by measuring plasma levels of glutathione, okay, an important intracellular antioxidant thiol, and its oxidized disulfide, GSSG, and their redox status, as well as measuring cysteine, an important extracellular antioxidant used to help produce glutathione. Conclusion results here: glutathione, an in vivo measure of intracellular oxidative stress, is an independent predictor of the presence of early atherosclerosis in an otherwise healthy population. This finding supports a role for oxidative stress in the pathogenesis of premature atherosclerosis, and its measurement may help in the early identification of asymptomatic subjects at risk for atherosclerotic disease. Let's paraphrase, or let's make that sound English. How many of you have ever gone to the doctor and been told you have a risk for heart disease, or a family risk, or have hypertension, or have high cholesterol, and so you're being medicated to reduce your risk? Now, in all of those that answered yes watching this video, how many of your doctors have ever measured your glutathione status or your cysteine status to see whether or not your body had the tools that it needs to help protect against the inflammation that's driving cardiovascular disease? If you've watched my show for any length of time, you've maybe seen me talk about this, maybe not, maybe you're new. This is a blood vessel. And so what happens, what causes the plaquing to occur in a blood vessel? We get damage to the lining of the vessel itself. It's inflammation. And there are a lot of things that cause inflammation. Toxins to the body, food allergies, being exposed to toxic metals, multiple medication use, environmental pollutants, food dyes, food additives, food preservatives, bacterial infections, viral infections. It's just a lot of things that can cause this multifactorial inflammation. But once the damage is done to the wall or the lining of the blood vessel, the body will start laying down cholesterol in that area in an attempt to try to put out the inflammation, in an attempt to try to negate that fire. Well, one of the things that helps with dealing with this inflammation is glutathione. So, if heart disease is inflammatory in nature, and glutathione is the tool that our body uses to combat inflammation and to neutralize inflammation, why aren't, instead of measuring cholesterol, which doesn't cause inflammation, cholesterol is just it's your body's way to patch the job, why aren't doctors measuring glutathione? This is something that can simply be done. I mean, you can measure glutathione in the serum, you can measure it in red blood cells, it can be measured intracellularly, you can measure the precursors for glutathione like cysteine. It's very easy to do, but very little or very few doctors do it. How many of you out there with heart disease as a diagnosis have had your glutathione levels measured? If you haven't, you should. According to this study, what they're finding is that if you have low glutathione, it puts you at greater risk for ischemic heart disease. And so when men have heart attacks, usually their first symptom is the heart attack. You can go your whole life for decades and not know, and then all of a sudden you have a heart attack. And many men, almost, I think it's more than half, die from that first heart attack. But doctors are so interested in medicating blood pressure and medicating cholesterol that they're not asking the right question. What is driving the process of heart disease? It's inflammation. And if we don't measure the inflammation, or we don't measure what helps the body protect itself from the inflammation, we're missing a big chunk or a big piece of what might be helpful. Here's another research study. You can see here it was a clinical trial on long-term glutathione supplementation, offering protection from oxidative damage and improving hemoglobin A1C. Hemoglobin A1C is measuring average blood sugar over time. So it's the average blood glucose in about a 3 to 4 month span of time. And so you can see here in this study, supplementation with glutathione caused a significant increase in blood glutathione levels, which is important to understand because a lot of people will tell you that, and doctors are just as guilty of this, they'll tell you that taking supplemental glutathione, because it's a tripeptide, it won't absorb. Your body won't absorb a tripeptide very effectively, but that's actually not true. And I'll show you some research that validates that here in just a minute. But glutathione supplementation caused a significant increase in blood glutathione and helped maintain the baseline hemoglobin A1C overall. These results suggest that glutathione supplementation is of considerable benefit to patients above 55 years, not only supporting decreased glycated hemoglobin, which is hemoglobin A1C, right, that average glucose, but also at supporting or decreasing 8-OH-DG. This is a marker of oxidation. So this is a blood test that can be run that measures damage to your cells, to your DNA, and glutathione deficiency can cause an increase in this marker, but also increasing fasting insulin. So the clinical implication of our study is that the oral administration of glutathione potentially complements anti-diabetic therapy in achieving better glycemic targets, especially in the elderly population. Again, this is a human trial, not an animal trial. If we had a government that was funding, great science all the time, we would be funding a lot of nutritional science. Most of the funding goes to drug and pharmacotherapies, which, it's all fine and good, but I think a good chunk of that money needs to be going at nutrition, because nutrition is where it's at. You see here in this particular study published in BMC Gastroenterology, efficacy of glutathione for the treatment of non-alcoholic fatty liver disease. And so you see here treatment with glutathione, in this case it was 300 milligrams a day for 4 months. That's what the parameter of the trial was, and the result, 29 patients finished the protocol. ALT levels significantly decreased following treatment with glutathione for 4 months. In addition, triglycerides, non-esterified fatty acids, and ferritin levels also decreased with glutathione treatment. Well, why is that important? Triglycerides are fat in the bloodstream that increase fatty liver and increase the risk of heart disease. It's one of the markers most cardiologists will measure regularly when you go in for your checkup. So what they're saying is glutathione, in effect, lowers triglyceride levels. Ferritin was also lowered by glutathione. Ferritin is an indicator for inflammation. So it's what's called an acute phase reactant protein. It's a protein released by the liver when the liver's inflamed. So if you have high ferritin levels, what this study is showing is glutathione was actually helpful at lowering those elevations. Again, glutathione has a very anti-inflammatory effect, and the suspicion is that's why it works. All right, moving on here. Let's talk about why you might have a problem with glutathione. There are certain behaviors that will reduce your body's ability to make glutathione, because remember, your body can make glutathione if it has those 3 amino acids. That's the cysteine, the glycine, and the glutamine. But certain behaviors deplete glutathione. One of them is lack of sleep, another is alcohol consumption, and another is high-intensity exercise. So maybe many of you are trying to take good care of yourself and you're exercising very intensely. Pay attention, because although exercise is good for you, high-intensity exercise will deplete your glutathione and put you at risk. So let's talk a little bit about some of these things here. So on an exercise front, you can see here physical exercise intensity can be related to plasma glutathione levels. In this study, the results suggest that glutathione plays a central antioxidant role in the blood during intensive physical exercise, and that its modifications are closely related to exercise intensity. And what they basically found is that high-intensity exercise depleted glutathione. Now, there are other studies that show that when athletes take glutathione, you can see here improvements in aerobic exercise capacity. So this is especially true when you combine glutathione with vitamin C. You get a decreased heart rate, and you get improvement of VO2 max. You get an enhancement of skeletal muscle oxygenation, so you get more oxygen into the muscles. You get an attenuation or a slowing down of breaking down of glutathione. Remember, glutathione is used up during exercise, so when you supplement, that reduces that. and you get a positive improvement in time to exhaustion, so athletes can perform longer. So again, glutathione can be depleted by intense exercise, but glutathione and vitamin C supplementation can also potentially enhance and improve exercise performance. So it's something to keep in mind, those of you who are doing high intensity exercise and you're really tired and you're not repairing and you're not healing, not recovering very well, you might want to consider having your glutathione levels checked. You can see here, I said lack of sleep was another driving force behind lower glutathione. You can see in this study many physiological and pathological processes such as infections, toxins, ionizing radiation increase bodily concentrations of oxidizing substance known as free radicals. In this study, our results show that the patients with primary insomnia had significantly lower GSH, that's glutathione, significantly lower glutathione activity and higher MDA levels compared with controls. MDA is a marker of oxidation. It's this chemical here, malondialdehyde. So lack of sleep, increased oxidation, and lower glutathione. And we have alcohol. You can see here, chronic alcoholism alters systemic and pulmonary glutathione redox status. So kind of in summary over here, chronic alcohol abuse is associated with an increased incidence of severity of acute lung injury. This has been linked with depletion of pulmonary glutathione. So in other words, the alcohol-induced lung damage reduces the glutathione levels in the lungs. And you see down here, capacity to maintain a reduced environment in the alveolar spaces, this is the little functional spaces inside of your lung, was overwhelmed in those who abused alcohol. The significance of alcohol-induced chronic oxidant stress in the alveolar space and the subsequent ramifications may be an important modulator of the increased incidence and severity of acute respiratory distress syndrome in this vulnerable population. So in essence, maybe you've got a lung inflammatory disease. Maybe you picked up a virus that caused an upper respiratory infection. Again, these types of things are already going to tax your glutathione status in the lung itself, but alcohol exacerbates that issue. So one of the key reasons why it's important to understand alcohol is a poison and you should minimize it as much as you possibly can. Who else is at risk for glutathione deficiency? So we mentioned alcohol, but we also have people with poor diets, low nutrient density diets. Why? Because you need nutrients to regenerate glutathione, and we'll talk more about that in just a minute. We know that people with obesity have lower glutathione levels when measured. We know diabetics, especially uncontrolled diabetics. We know that stress reduces glutathione. We know that those with chronic inflammatory diseases, all the reasons I just showed you, have lower glutathione. We know that exposure to environmental pollutants, what are we getting here? Environmental pollutants would be the chemicals in your food, chemicals in in the environmental air from the burning of fossil fuels, among other things. We know the chemicals in plastics. We just saw a major study published here recently on plastics, microplastics being found in, remember I drew this earlier for you, but those plaques that form in the arteries, they're finding plastics in those plaques, microplastics. So again, environmental pollutants puts more tax, more pressure on your glutathione systems. And then we also know that just generally speaking, levels of glutathione tend to start dropping off at age 60. We don't know why that happens. It could be that it's not necessarily the aging process that causes the lower glutathione. It could very well be the accumulation in bad behaviors over time that leads to this drop off. I don't think that science is super clear on that, but we do know that people over the age of 60 generally tend to have lower levels of glutathione compared to younger. So smoking is another major factor, and bring up the study on smoking. So you can see oxidation of glutathione and cysteine in human plasma associated with smoking. And the bottom line in this study is that smoking causes a dropping or a utilization. It uses up your glutathione and thus creates a greater a greater oxidized form of glutathione in your bloodstream. So again, smoking creates a problem for glutathione maintenance in folks, and this is a human study as well. So, you know, at this point, at this day and age, it's if I have to tell you that smoking's bad for you, you've got bigger problems. Let's talk a little bit too about drugs that deplete or interfere with glutathione. And so many of you, if we go back to what we were talking about earlier, many of you have inflammatory diseases. Now, if we're talking about industrialized countries like the U.S. and the UK and the European Union, what do we got? We have, you know, you have an illness. Something's wrong with you, right? So you go to your doctor. You go to your doctor, you get a diagnosis. That diagnosis generally matches a medication. So your diagnosis, for example, is headache. Maybe they pull out acetaminophen or NSAIDs. If your diagnosis is severe back pain, maybe they even pull out some of the opiates, right? What bottom line is, this is kind of the way that works, right? You go to the doctor because you're not feeling well, you get a diagnosis, you get a medication. Now, the vast majority of reasons that people go to see the doctor are what? What are they really? What is the reason the person is going to the doctor? The reason the person's going to the doctor is because they have inflammation. If we really want to simplify it, you are inflamed. For whatever reason, you are inflamed. Now, the doctor's going to give you a medication, and some of these medications, what do? They block inflammation. So, you know, the goal with the medicine is to block inflammation so that you feel better, right? So the medication has the potential to reduce symptoms. What medications do not do is they do not fix why you are inflamed. That's really where the question needs to come in. And the reason I point all this out is because if you're being medicated because of an inflammatory disease, but you don't know why or what you're doing that's causing or driving the inflammation, then you're just going to be on medication. And you know, one of the problems that we see today, one of the biggest problems we face is this problem here called polypharmacy. This is when doctors just continually add more and more medication to a person to try to treat their symptoms. Again, it's all about symptom management, and it has nothing to do with resolution of illness or education about why illness exists. And you get all these different medications, and these medications have to be processed. Well, what processes medication? What does the body use to process the medication? Well, it uses the liver and it uses the kidney. And so what is the primary agent of medication breakdown? Well, one of the primary agents is glutathione. So if you're a polypharmacy case and you've got multitudes of different medications, you're taxing, potentially reducing your glutathione status, because your body's not only faced with environmental pollutants and food pollutants and every other type of chemical exposure that you're getting, but now your doctor's pumping you full of chemicals to treat the symptoms of the environmental and food choice-based inflammation that you're creating for yourself, and so you're taxing your glutathione status even more. And so you'll never win in this situation where you're using multiple medications to treat your symptoms. And it's also important to understand that these medications that are being used to treat your symptoms drive down your glutathione and thus potentially accelerate the aging process and accelerate or reduce your body's capacity to handle or deal or cope with inflammatory stress. So very, very important that you understand that. Now, as I said earlier, your body makes glutathione. So glutathione, you can take NAC or cysteine and glutamine and glycine, because these three are the primary amino acids that are the building blocks for glutathione. But your body can take these three, and thus it can produce glutathione. So you can eat glutathione as well. There are certainly foods that contain these nutrients. There are foods that contain glutathione directly. But your body can produce it. But in order to do that, it doesn't just require these three amino acids. Glutathione can be regenerated. There's a number of other functions that are important for the preservation and the regeneration of glutathione, and that's what these nutrients here are. So you can see selenium and alpha lipoic acid, vitamin C and E, vitamin B2, B12, adequate protein, and omega-3 fatty acids are all necessary to help glutathione work and to regenerate glutathione. And so here's, I showed you kind of a similar example earlier here with glutathione, the glutathione cycle. Well, part of the glutathione cycle is that it helps the vitamin C cycle, and vitamin C can be regenerated as a result of the action of glutathione, and as can vitamin E, right? We regenerate vitamin E. So you've got vitamin E free radical, which is a reduced or an oxidized form of vitamin E being replenished as a result of vitamin C, and you've got an oxidized version of vitamin C being replenished into ascorbic acid as a result of the action of glutathione. So these three nutrients interplay with each other. They all help regenerate each other, and they all help each other work better. So very important, because it's not just about taking glutathione. You also want to make sure your diet contains the right types of nutrients to help with glutathione as well. Now, I'd like to thank Deanna Minnick here. She did a fantastic review published in the Journal of Nutrients a few years ago, where she kind of very eloquently illustrated the nutrients involved in the production and the maintenance of glutathione status and glutathione regeneration. And so you can see the nutrients listed in this diagram are labeled in blue. You've got things like folate, this is vitamin B9, and riboflavin, which is vitamin B2, and then betaine and vitamin B12 as well, all playing a role in the methylation cycle up here. That methylation cycle helps to convert cysteine, or homocysteine rather, into cysteine. Remember, cysteine is one of the amino acids that we need to form glutathione. And so then you get to cysteine and you add glutamate to that. And then down here in one more reaction, you take that molecule and you add glycine to it, and that's how you get glutathione. But again, to get down here, you also need nutrients. Again, B12, riboflavin, vitamin B9, this conversion of homocysteine to serine. This requires vitamin B6, so nutrients important for this pathway. And then nutrients that help regenerate glutathione, lipoic acid, and vitamin C. We could add selenium over here to that list, and we could add riboflavin again, that's vitamin B2 here to this list. We have magnesium that plays an important role in the balance of glutathione, as well as vitamin E and omega-3 fatty acids. So again, you've got a lot of nutrient interaction and chemical interaction here that continues to allow your body to produce glutathione. And notice that all these things, there's a lot of redundancies built in because glutathione is such an important molecule. Remember, it is the master antioxidant, so your body has a lot of different ways it can recycle it and regenerate it. You can also see over here, brassica vegetables, green tea, those things can also help preserve glutathione, and they contain sulfur-containing agents that help to generate glutathione as well. So it's not just about necessarily supplementing with glutathione per se. You need those nutrients in your diet as well. Now, these are foods that can really help to boost glutathione. These foods contain glutathione, and so avocado, I don't have to read this list to you. You can print it out at home. But if you want to try to enhance or increase your glutathione from your diet, these are fantastic food choices that you can navigate toward. This study published a number of years ago was actually analyzing the content of glutathione in food. And so if you're looking at kind of hierarchically, this ham actually quite high. Beef was very high. Beef steak was very high. Spinach had high levels. Asparagus had high levels. So you kind of see those foods super rich as far as glutathione containing glutathione. Okay. So should you supplement? Let's talk about, well, the RDA itself does not have any kind of recommendation on glutathione supplementation. So there's no RDA. And the reason why there's no RDA is that glutathione is not essential It's not an essential nutrient. Essential nutrients are defined as nutrients that your body cannot make on its own, that you have to eat them from your diet. Well, our bodies know how to make glutathione if we get all the other things that are necessary to make glutathione. So it's not an essential nutrient, so there's not an RDA for it. The average person in the US consumes between 3 and 150 milligrams of glutathione a day. Now that's a pretty huge difference, right? I mean, this is going back to what I was saying earlier about poor diets, where there's a nutrient dense diet versus a low nutrient density diet. Those poor diets are going to contain kind of closer to that, very low glutathione content, where a nice whole foods diet is going to get you more of glutathione in your day. As far as supplementation, though, is concerned, should you supplement? Well, here's the safety that we know. Between 250 and 1,500 milligrams a day is relatively safe. There have been human studies on these doses, and nobody really has ever reported a dangerously toxic side effect from glutathione. So we know it's safe, we know it's well tolerated. There's been a number of research studies that have already validated that in humans. So should you supplement? Possibly. If you struggle with a lot of those different conditions, it may not be a bad idea to support yourself. What should you supplement with? I hear these arguments a lot that glutathione cannot be absorbed. This is one of the biggest arguments against glutathione, is that a lot of people say it cannot be absorbed in the GI tract. So supplementing with it is a waste of money, and this is actually not true. This has been disproven. These are the research studies that disprove that. So you can see here this particular study, randomized, double-blind, placebo-controlled trial in humans on glutathione. This is a type of glutathione. It's a patented type of glutathione called Cetria. And so you can see in this study of 61 individuals taking 250 milligrams a day orally, or 1,000 milligrams a day orally for 6 months. And what did they find? And this is oral supplementation. Again, what's the argument? Is that if you take glutathione orally, you can't absorb it from the GI tract. Okay, this study proves that wrong. They used oral supplementation. What did they find? They found an increased whole blood glutathione. They found increased glutathione in the red blood cells, that's erythrocyte GSH. They found increased glutathione in the plasma. They found increased glutathione in lymphocytes. They found increased glutathione in buccal cells. They found an enhanced glutathione oxidized to non-oxidized glutathione ratio. And they found improvement in natural killer cells' ability to kill effectively, or their cytotoxicity. So this data right here says that glutathione absolutely can be absorbed by oral supplementation. We know that to be true. Now, some would argue that glutathione orally taken is not very well absorbed, and that you should use liposomal glutathione, which you can see in this study on liposomal glutathione. This was a pilot trial in 12 individuals, and what they did was they gave 500 milligrams orally, or 1,000 milligrams orally for 4 weeks. And they also found very similar things, right? They found increased blood glutathione, increased red blood cell glutathione, plasma increase, as well as a improvement in natural killer cell activity and an improvement in lymphocyte proliferation. Again, whether you're using a non-liposomal glutathione or whether you're using a liposomal glutathione, they had very similar outcomes. Both indicate that you can absorb glutathione if you take it orally in supplement form. So let's just kind of straighten that out right now, that if you want to take glutathione as a supplement, it will enhance your levels internally, and we know that. It's not a waste of money. It's not ineffective. So you can use it that way. You can also take supplementally, you can take things to enhance glutathione that aren't glutathione. For example, we know that taking NAC leads to improved glutathione levels. We know that combining NAC with glycine improves levels. We know that taking vitamin C improves GSH levels. So it's not just always as simple as, hey, I'm going to take more glutathione, although, again, you can. It's very safe in doses up to 1,500 milligrams a day in humans. So the question becomes, should you supplement? And I would say it's an answer really only you have for yourself. Do you have an inflammatory condition and you feel like glutathione might help support your body's ability to cope and adapt and deal with inflammation? The answer may be yes. Now, where you might consider not supplementing, let's say you're on multiple different medications and you start really high-dose supplementing with glutathione. Well, what that might do is it might clear those medications out of your system a lot more quickly, and it might affect or alter the symptoms or the side effects potentially of that medication. And that's something that if you're doing that, if you're trying to do this and you're on multiple medications, it's certainly something you want to have a conversation with your doctor about so that you don't end up getting very confused very quickly. But glutathione is, again, it's very safe to take. If you're in Europe or the US, it's not a drug. You can buy it over the counter. It's very easy to purchase. And with all of its functions, it might just be something that you want to incorporate in your diet. Now, I'm a really big fan when answering this question, should you supplement? I'm a big fan of this. Test, don't guess. Should you supplement? Should you spend your hard-earned money on buying a supplement? The answer is I don't know. If you're not low in glutathione, if your glutathione levels are already really fantastic, would spending more money on a glutathione supplement be beneficial to you? Probably not. And we could argue it's detrimental because you're spending money on something that's not very helpful, so it's costing you money. But if you test your levels and you're not guessing, this is going to give you the best possible answer. So, performing an INA, an intracellular nutritional analysis that measures things like glutathione, but also measures many of the nutrients that help your body to generate glutathione. So measuring, selenium status and cysteine or NAC and vitamin C and vitamin E. Looking at these nutrients, looking at amino acids like glutamine and glycine, because that's really going to help give you the answer of, one, should you supplement? Is supplementing the right thing? Or is there something else you should potentially supplement for that's going to help your body build or regenerate oxidized glutathione? So at the end of the day, it's always better to test and not guess. You can ask your doctor to test, but one of the best ways to test is what's called INA, intracellular nutritional analysis. Most doctors, they don't train in nutrition, so they're not going to know what that means. Test you could ask for an erythrocyte, GSH. That would be one way to measure it more accurately. You could ask for plasma, but plasma or serum levels, they're not going to be as accurate because they're more of a reflection of your last meal or your last kind of what's been going on in your life more recently. Like if you just exercised very intensely this morning and you're going to draw your blood at your doctor's office, you might find that your plasma glutathione levels are lower because you just had intensive exercise that morning. So these are kind of less accurate. Erythrocyte would be a little bit better, more accurate way to assess it because red blood cells have a 3-month life cycle, so it kind of can give you an average. But INA, these cells are lymphocytes, so these are actually going to give you an indicator of the 6-month status of your glutathione, and so 6-month status is far better because it gives you more of a window of opportunity of understanding how long you've been depleted in glutathione, and so it gives you a better opportunity or window at also supplementation or supporting glutathione either through diet change or through increasing your nutrient supplementation. So in a nutshell, the best thing you can do is test, don't guess. Now, if you do decide to supplement with glutathione or any of its precursors like NAC or cysteine, when you open your bottle or take the supplement, just be aware it smells super sulfury. I mean, it's going to smell bad. It's going to smell like a rotten egg. That doesn't mean that the product is bad. That's what sulfur smells like, and that's what glutathione contains. It contains sulfur. So when you're opening that bottle and you smell that sulfur, that shouldn't scare you away or make you think that the product is bad. Okay, that's our crash course on glutathione. I hope it's been helpful for you. We'll put the show notes down below in the comment section for you. So if you want to access any of these studies or any of these slides, they'll be there for you to check out. Have a great day. We'll see you in the next episode. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.